Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.
Smoking poses a serious threat to health, with one of its most devastating outcomes being oral cancer. Harmful chemicals in tobacco directly damage the cells of the mouth, increasing the risk of malignant growths. Despite this danger, awareness remains limited, often leading to late diagnosis and poorer outcomes. Educating people about the strong link between smoking and oral cancer is crucial for prevention, early detection, and timely intervention. Identifying warning signs such as persistent mouth sores or unexplained lumps and encouraging smoking cessation can greatly reduce the risk. Today, let's emphasize the critical role of awareness in combating oral cancer and discuss proactive steps to protect individuals from this preventable disease. Welcome, everyone. I'm Dr. Samya Saluja from THIP Media, and today we are addressing an often overlooked issue, the link between smoking and oral cancer. And joining us to shed light on this important topic is esteemed dental expert Dr. Lavina Arya. Dr. Lavina Arya is a distinguished academician serving as an associate professor in the Department of Oral Medicine and Radiology at the Postgraduate Institution of Dental Sciences, PGIDS, Rohtak. With over 17 years of experience in dentistry, she has established herself as a leading expert in diagnosing and managing complex oral health conditions, particularly those requiring advanced radiological assessments. A passionate educator, Dr. Arya has played a pivotal role in shaping the next generation of dental professionals, mentoring students, and guiding research initiatives that contribute to the ever evolving field of oral healthcare. Her commitment to academic excellence is reflected in her extensive research contributions, published works, and active participation in national and international conferences. Beyond academia, Ma'am is known for her patient centric approach and expertise in the early detection and management of oral diseases. She integrates cutting edge diagnostic techniques with compassionate care, ensuring optimal treatment outcomes for her patients. Through her relentless pursuit of knowledge, Ma'am remains a respected figure in dental education and oral health care, embodying the perfect blend of academic brilliance and research based expertise. Dr. Lavina Arya, TIP Media welcomes you, ma'am.
Thank you. Thank you so much, Dr. Soumya.
Thank you so much for your time today, ma'am. Ma'am, we all understand, that smoking and its connection to oral cancer, it's a very significant health concern that impacts not only individuals but also their families and let's say the wider community. The harmful effects of tobacco use, particularly, its role in increasing the risk of oral cancer. I suppose it remains under recognized. So, to initiate our discussion on this critical topic, I'd like to begin by asking that what exactly is oral cancer and which parts of the mouth does it commonly affect?
Dr. Soumya, thank you for your question. We all should be aware about what exactly is oral cancer. So it's a cancer which affects the mouth. It can affect any part of your mouth, like it can be tongue, it can be your cheek, it can be one's lip, the inner lining, or even the outer, or
Right.
early part of entry of the throat, or gums. Any part can be affected.
Right, right, ma'am. And now coming on to the link that we have been discussing so far on, would be the role of smoking here. So how does smoking contribute to the development of oral cancer?
See, smoking is a major risk factor when it comes to oral cancer. It's
Right,
one form of taking tobacco, and
right,
either it's in form of, whether it is in form of, bidi, cigarette, or e-cigarettes, hookah. In any form, it is very harmful. It has lot many such chemicals which predispose one to oral cancer.
right. And like you've just mentioned, that tobacco, be it in any form, it contains certain chemicals which are responsible for the cancer or the oral cancer development. So, what are the specific chemicals in tobacco smoke that are known to be carcinogenic?
See, there are certain, there are almost more than 7,000 chemicals when you inhale that smoke from the cigarette. Out of that, 70 are known chemicals which can produce cancer. What we call as carcinogenic, the one which are known to produce cancers. It can be, like technically speaking, many names are there: nitrosamine, formaldehyde, polyaromatic hydrocarbons. But all these are cocktails of chemicals which can really affect the oral cavity badly.
Right, right, ma'am. And I'm sure that somebody who's just taken a single track of smoke might not be at a very high risk of developing oral cancer. So now coming on to the duration and the frequency of smoking, ma'am, how does these two particular parameters, let's say duration and frequency of smoking, influence the risk of developing oral cancer?
Dr. Somet, definitely the more the duration, like earlier you start, more the duration you are exposed, more the likelihood, manyfold the chances increases, and the more number of times, that is the frequency, that also increases the chances of oral cancer. So both are having a relationship with the amount of exposure you are having.
Right. Okay. Right, ma'am. And could you just help us understand that what is the exact duration, or let's say, some particular upper and lower limit that would actually put someone at a higher risk of developing this condition?
See, if you're taking, we say packs per year, how many
Okay.
cigarettes per day, then year we calculate. So higher
Right.
the number, the more
Yes.
the risk. Almost, and the risk by 10 years of continuous smoking, it predisposed you to almost 5 times.
Okay. Right. Right.
And
So
the
somebody
initial
who's,
puff you were talking about, I would just
yeah.
like to state one thing. What happens initially is not, is the usually introduced during the teens and all, is the thrill
Right. Right.
and the presence of that one chemical nicotine, which
Right.
slowly, creates the craving, and then the duration and frequency keeps on increasing.
Right, right. So what I understand is that the addictive nature of nicotine is the culprit here, which would actually, increase the so-called number of packs per year, I suppose. Right, right. And now coming on to something that we've been hearing a lot, let's say, by social media, is the use of cigarette smoking and other tobacco products. So, are there any differences in oral cancer risk between cigarette smoking and the use of other tobacco products such as smokeless tobacco?
See, in India, there's a lot of availabilities of those colorful pouches.
Right,
Every nook and corner, those are available. And those are a form of, either it can be gutkha, in which the supari is mixed, or a canny. In many form, it is available. So what
right,
happens when you smoke? Basically, the smokes is exposing the whole heat and everything is, and the chemicals are getting exposed throughout the oral cavity or mouth.
right,
And when you
right,
keep the smokeless products, what they do is usually keep it either between, cheek and the gums, or between lips and the gums. And what happens, that particular site is, there's a long term exposure. keep it for 15-20 minutes. So that site particularly becomes very much predisposed. So there's a different spectrum of site predisposition we get when it comes to smoking and in smokeless form. But yes, both are equally harmful for your
Right.
overall health and oral cavity, mouth.
Right. So I suppose both are responsible for their respective, medical conditions or the development of medical conditions in the oral
Yes,
cavity. So,
yes,
so both
yes.
are as harmful. Right, right. And now another lifestyle modification, or let's say another choice that people, are coming up with is the alcohol consumption, the increased alcohol consumption. So, ma'am, how does combining smoking with other risk factors such as alcohol consumption affect the likelihood of, developing oral cancer?
Dr. Soumya, we have, in Hindi a saying, Karela wo bhi neem chada. So what is happening is that these two are acting together, uh,
Right,
up together. The one is loaded with chemicals which can cause cancer, and one is like a facilitator. It has a
right,
drying effect on the mouth, and the lining is dried, and those cancer producing agent can leach out. Uh,
right,
so all this combination is troublesome. It increases the risk multifold.
right, right. Right. And for someone who's actually developed this particular condition, ma'am, I'm sure there must be some, clinical indicators that they should be knowing about so that they can reach out to a specialist like yourself in time. So, ma'am, what are the early signs and symptoms of oral cancer that individuals who are actually smoking extensively, particularly, should be aware of?
So very important. This question is really very important because recognizing it is early is a very important and crucial thing, because if it is diagnosed early,
Right.
and with oral cavity, we have an edge that, the
Ji,
tissues we can see. What happens
ji,
inside the lungs or inside the body, you cannot see. You stand
right,
in front of mirror, you yourself can also see certain changes. So
right.
being aware about it is very important. And the signs one should be looking for, it can be either some red or white changes,
Ji,
or patch, or
ji,
it can be a long standing ulcer. Okay,
right.
ulcer or a sore, what we call any lump or a growth, and a certain mobility of the teeth. So
Ji,
these can be some worrisome indicator, and you should get
right,
yourself checked.
right, right. And somebody who's actually, come up with a particular, clinical indicator that you just mentioned probably would be needing, a professional diagnosis and would be needing professional help here. So how do doctors confirm, the diagnosis of oral cancer?
See, when it comes to oral cancer, clinical examination is utmost important. You can
Ji,
visit like your dentist.
ji,
Among the dental faculty, oral medicine and radiology is a specialty which particularly deals with the early signs and symptoms and the stages of oral cancer.
ji,
Okay. And you can visit an ENT. So all these
ji,
doctors you can visit. And what is the
ji,
primary tool to diagnose? One is
ji,
definitely the clinical examination history. And
ji,
second is biopsy. What is
ji,
biopsy is, we take a very small area or a tissue from the suspected site. It is
ji,
done under LA. That is,
ji,
we numb the area and take it. So it's not, it won't be a scared or a painful procedure, because the
right,
aspect will be taken care, and then it
ji,
will be sent to laboratory for
ji.
confirmation.
Ji, ji, ma'am. And now for the ones who have a confirmed diagnosis of oral cancer, what treatment options are available for the management of this particular condition?
Yes, when it comes to treatment, the primary line of treatment is surgery and
Ji,
radiotherapy. In some cases, chemotherapy can be used as an agent.
ji,
What is very important to know in this, the earlier it is detected, the
जी,
lesser the stage, the
जी,
better, less invasive will be the treatment.
जी,
So it's very important to, get to the diagnosis early.
जी, जी. And now coming on to something that I personally believe, is the cornerstone in management of any particular condition is, changing your habits, your lifestyle choices. One of which could be quitting smoking here. So, can quitting smoking reduce the risk of developing oral cancer? And if so, how does the risk change over time after cessation?
See, quitting smoking can be a major lifestyle modification. It
Ji,
just doesn't give you an edge or protection against oral cancer. In fact,
right.
about from a lot many types of cancer.
Ji,
And what happens is, once you quit, they
ji,
say technically the changes in the body are seen, minute by minute, month by month. And when it comes to oral cancer, they say by 5 years, your risk become less than 50%, goes to almost 50%. And within
okay,
10 to 15 years is as good as a non-smoker.
okay. And apart from smoking, ma'am, what additional preventive measures can individuals take to lower their risk of oral cancer? Aside, and I mean not smoking per se, but the additional preventive measures that you would suggest them.
See, a healthy diet is very, very important. It is
Right,
full of, blend of some good vitamins, uh, certain chemicals, good chemicals, what we call antioxidant, which helps the tissue and the lining to come up healthy. Okay, so very important to have a healthy diet
ji,
and avoiding other cofactors like we talked about alcohol also,
ji.
right? Then it's very important to have a uh, overall lifestyle uh, changes.
Okay. Right, right. And now something that I also believe in is very important to, prevent any particular medical condition, and that is the right health information, or what we call is the health literacy. So, how does one understanding of health information impact their ability to prevent and detect oral cancer early?
See, as it is said, awareness precedes change. So the very
Right,
reason we are sitting here talking about all this is
right,
it's a very, very important thing that once you know what is right,
right,
once you
right,
know when to approach,
right,
these factors really can make a lot of difference. So
right,
health literacy is, I think, the one of the main factor which can change lot.
right. Okay, and now I'm just going to summarize this wonderful session by a final concluding question here, ma'am. That can you outline a detailed step-by-step to-do list specifically for smokers to help them reduce their risk of developing oral cancer?
See, quitting is a decision,
Right,
and you should be taking it for the correct reason. You should know your reason. You
right,
should know your why, and easier
right,
will be how. So if
right.
you know why you're quitting, for let's say a middle-aged person, probably reason can be family, kids.
G,
For
G,
a teenager or a early youngster, the reason can be looks. So you should be very much clear about your reason,
right,
right? And we mean just prepare a quit plan and involve your
right,
family and friends in that. What happens if you are do you decide to quit, you go to a bunch of friends and then you are sitting in that
right,
environment and somebody is pushing you, you tend to
right,
get weak. And
right,
those your family and friends should be informed about your decision, so you get
right,
some support from there also, from your surrounding. This
right,
identify your triggers, what
right,
gets you to go for that some smoke break. That can be boredom also,
right,
and that can be stress. So identify those factors and figure out prior, prepare yourself, have a plan in hand. These conditions are liable to happen. But
Right.
now what will be my choice? What am I supposed to do? And
Right.
one very, very important factor, which one should be aware, that what happens when you try to quit in the earlier phase, there are a bit of withdrawal symptoms of cravings, what we say, that
Right.
urge to take it. So
Right.
be aware that urge is for few seconds, 2 minutes. And
Right.
as you will keep on following that path, their duration and their number will keep on decreasing. It's just the
Right.
method of those few minutes. Prepare
Right.
yourself what you will do. We say 4Ds
Right.
approach. That is, you delay that urge, you can distract yourself, you can drink water that time, you can take deep breathing. So identify your strategy. You can
Right.
figure it out with your doctor also. Okay.
Right.
And make a detailed plan. If required,
Right.
there are medicines also available for all this which can
Right.
help you. And one very important factor, I'll say, what happens sometime you have a slip. It happened,
Right.
you went strong for few days, and one fine day there is some. Don't take it as a failure. It's just a
Right.
transient hurdle. And
Right.
you're choosing life over addiction, which is a very good decision. Keep
Right.
following, keep going strong. I like to say the one who are trying to do this, and it will be a very good blessing for your life.
Right. So, what I understand is that mental preparation is the key here. You have to be mentally very strong, right? So, quitting for the right purpose, having a very good strategy to quit, and identifying your triggers, and of course, seeking familial support and medical support. All of this put together can actually help you quit. Wonderfully put, ma'am. So thank you so much. We really appreciate your presence with us today, ma'am. And I am hoping that the enlightening information shared will be valuable to many families out there. So thank you so much for joining us. It's really been a pleasure.
Thank you. Thank you so much.
Thank you so much, ma'am. And for more such informative videos, please do subscribe to our channel and press the bell icon for regular updates. Thank you once again. Thank you.